Climate change and vector-borne diseases, understanding the health, cultural, and nursing implications.
For our presentation, we will focus on climate change and its relationship to vector-borne diseases. Our main objective is to raise awareness about these diseases, especially in communities with limited healthcare access, and to highlight prevention strategies. As nurses, we have a responsibility to recognize the barriers these communities face, especially among low-income groups who are struggling with vector-borne illnesses and have limited access to proper treatment. We will also discuss the economic and philosophical factors associated with these vector-borne diseases and their connection to climate change, mainly how they impact specific countries. Climate change is a health concern with this illness due to its rising global temperatures, which are expanding mosquito habitats and increase the risk of infection in warmer areas. For instance, the article highlights countries with hotter climates such as Mexico experiencing higher rates of vector-borne diseases, which are now spreading to other regions including Italy and France as global temperatures rise. These environmental challenges bring both economic and health implications, which we will further discuss. Nurses face challenges as well. One of the main difficulties is identifying the symptoms early, often due to its limited knowledge and experience. This highlights the need to increase awareness and education among nurses about these diseases, as the symptoms can be life-threatening, affecting the bones and the joints, causing high fever.
I will be discussing the peer-reviewed articles regarding vector-borne diseases and the effects of climate change. The first article, Nurses' Perception of Climate-Sensitive Vector-Borne Diseases, a scoping review conducted by Vanderburg et al., reviewed existing knowledge that nurses had regarding vector-borne diseases, specifically Lyme disease and West Nile virus. The review was conducted using Joanna Briggs Institute scoping review methodology. Multiple research databases were used to retrieve existing literature that measured a nurse's knowledge, perception, attitudes, and experiences with vector-borne diseases. After review of the databases, researchers obtained 33 articles, which included 7 from Gray Literature that had met the criteria established for this review. The researchers concluded that insufficient literature and research was found that measured the capacity in which nurses were prepared and educated on vector-borne diseases. Researchers found that additional research was required to better understand the perception and knowledge nurses had on vector-borne diseases, as well as more integration of education on vector-borne diseases in school curriculums, enabling nurses to be more informed and prepared on this topic. Overall, the article highlighted the importance of adequate knowledge that nurses should obtain to ensure overall health promotion when engaging with and providing care for individuals and communities vulnerable to vector-borne diseases. The second article, The Impact of Climate Change on Travel-Related Vector-Borne Diseases, a case study on dengue virus transmission, was a study conducted by Abbasi, which focused on how climate change influenced the spread of vector-borne diseases and its implications on healthcare on a worldwide scale. The article also highlighted the impact of travel and its complications in containing the disease and limiting transmission. A variety of data was used to study the effects of climate change, such as environmental data analysis, mosquito population survey, and dengue case reports. With this data, researchers were able to make predictions on the spread of vector-borne disease, specifically dengue, in a variety of different climate scenarios. The results concluded that there was a direct correlation with climate change and increase in vector-borne transmission in non-infected geographical areas. Such climate changes included rising temperatures, shifting precipitation patterns, and high humidity levels. Overall, the article highlighted the importance of early intervention to further prevent spread of dengue virus and the lasting impacts it would have in our healthcare system, ensuring global health security.
In our news article, the journalist uses both phenomenological and critical social theory to portray the negative impacts of the chikungunya virus. The journalist presents the rising threat of this virus as an underestimated health and socioeconomic concern. Through a phenomenological approach, Nolene uses quotes from doctors and researchers in the field on how the virus impedes a person's daily life functioning. It is more powerful to include direct perspectives from people living with residual symptoms. Nonetheless, provocative examples such as being unable to type on a phone exposes the reality of daily living after being afflicted by the virus. This approach is impactful as it brings the severity of the disease into a perspective that most people can understand. There is emphasis on using critical social theory in the news article to highlight inequities and power imbalances in research and funding distributions of vaccines. The journalist uses statistics to show vaccine cost and a timeline of disease outbreak caused by lack of vaccination to vulnerable populations. For example, the Caribbean has been hit twice with the virus in the span of 2 years since there was no herd immunity. Disparity in vaccine distribution comes from industrialized countries like the United States and Denmark funding the research and selling limited vaccines at exorbitant costs at $270 to travelers who end up spreading the virus. This favoritism towards travelers is only mentioned in passing, so the impact of downstream prevention is not discussed. The journalist only briefly summarizes that regions with poor water, sanitation, and low income are vulnerable, but providing examples of impact on such groups can enhance the discussion further. Only Paraguay is mentioned, and along with other low economic regions in South America, their poor infrastructure and health systems continually leave them at risk until affordable vaccinations can be procured.
Cultural considerations contribute to how vector-borne viruses are treated and managed. However, society has lacked cultural concern for the chikungunya virus due to its mild symptoms and low fatality rates. Despite its discovery in the 1950s, attention to the virus only began in 2004. Through underestimation of its severity and the effects of climate change, the area of impact has intensified, expanding into regions with warmer climates and creating ideal living conditions for vectors. Voluntary and involuntary travel contributes to the increased spread of the virus by transferring it between outbreak regions and introducing it to new areas. Global warming attracts privileged individuals to international travel. However, popular tourist destinations found in subtropical and tropical regions act as reservoirs due to optimal environmental conditions and dense populations. Tourists who travel to such places become exposed to the virus, ultimately increasing the risk of global spread through their movement. Furthermore, areas that are susceptible to climate change-related disasters, such as typhoons and floods, force individuals to relocate due to their inability to sustain previous lifestyles. As a result, it displaces people into regions with unreliable sanitation and water supply. Thus, the chance of further transmission increases due to the risk of population density and the lack of resources for hygiene. Marginalized groups include low socioeconomic countries that do not have the facilities for preventative measures to overcome climate change and its effect on vector-borne viruses. For example, the implementation of climate change measures is highly associated with the reduction of disease. Thus, countries lacking these strategies face a rapid rise of infections. Limited resources in low-income nations hinder the implementation of such measures and increase vulnerability, conversely to wealthier nations that have the means to do so. Therefore, a significant global issue in prevention stems from class-based disparities. Finally, this marginalized group is a consistently overlooked factor when developing preventative measures. The discussion focuses more on prevention strategies for tourism, which is commonly reserved for those of higher social and economic class. However, including the population of underprivileged endemic areas affected by tourism, it is possible to advocate for herd immunity, which offers more global protection against transmission.
As nurses, we have an essential role in addressing the growing link between climate change and vector-borne diseases. The article, The Impacts of Climate Change on Travel-Related Vector-Borne Diseases, a case study on dengue virus transmission, discusses how rising global temperatures, changes in rainfall patterns, weather extremities such as floods and typhoons are expanding mosquito habitats and allowing a global spread of the virus. The article also focuses on nurses' knowledge, perception, and preparedness in dealing with climate-driven vector-borne diseases, highlighting education, prevention, and advocacy gaps. Abbasi emphasizes the need for early intervention strategies, better surveillance, vector control, and adaptation to climate changes in order to mitigate future spread of the virus. The article also emphasizes the urgency for implementing vector control strategies and travel-related surveillance such as enhanced screening, traveler education, and proactive public health strategies.
Additionally, the article Nurses' Perception on Climate-Sensitive Vector-Borne Diseases, a Scoping Review, discusses how imperative it is that nursing students are educated on treatment of vector-borne disease, considering our current climate crisis. The CASN has created a guideline for undergraduate nursing education on climate-driven vector-borne disease. These standards focus on implementing evidence-based strategies that prepare both nursing students and current nurses on how to treat spikes in vector-borne disease cases. Vandenberg et al. Highlights nurses' vital role in community-wide education on transmission and prevention of vector-borne diseases such as chikungunya. Through education, nurses are able to address the health impacts on Canadians to build relationships founded on quality care, empathy, and cultural sensitivity.